if your fasting blood sugar is 99%, but we know that by at 100, we consider you pre-diabetic there.
What lab should we be requesting that talks to our longevity?
C-reactive protein, that is number one. If you are able to reduce inflammation in your body and getting those levels at an optimal range, your C-reactive protein is one of your most important labs for longevity. We sufferers from anemia. There's a lab called ferritin. We know that anemia means low blood, your blood is low, things of that nature.
This means in 3 years, you could be looking at, diabetes. None of those things show up on the labs, and no one is going to tell you that because we need a beacon, a map for what our body is getting ready to do or what it's not showing as of yet, but what we should be paying attention. So that way we're more preventative and we're more proactive than reactive. Black women are dying from conditions that should have shown up in their labs years before they became a crisis. Heart disease, fibroids, lupus, diabetes, kidney disease. These are not random. They leave a trail, and that trail is in your blood work. But here's the problem. Most of us hand our body over to a doctor, get a result notification, see the word normal, and trust it. What we don't know is that the reference ranges used to determine what's normal were largely built from studies that did not include us. And what's normal for the general population is not always optimal for Black women. That's why today I'm sitting down with Dr. Ashley Griffith, a clinical pharmacist who takes an integrative approach to health, combining clinical science with dietary counseling, stress management, and supplement strategy. She believes that healthcare starts in the community long before we step foot in a doctor's office. And today, she is here to help us understand what's in our labs and why it matters for our lives. We're breaking down the biomarkers every Black woman should be tracking, what to ask for at your next appointment, and how to stop accepting normal when your body is telling you something different. If this is the kind of conversation that you need in your life, subscribe and follow so you never miss an episode. This is the Lushness podcast. Let's get into it. Welcome. I know how important this topic is, and I know how passionate you are about this topic. Yeah. So thank you so much for being on the show. Thank you so much for being here. Welcome.
Thank you.
I can't wait to talk about this because one of the things that I know for a fact is that we go to the doctor. This is standard, and I think it's standard for everyone, right? You go into the doctor, they tell you labs look great. You're happy. You're relieved. You're like, oh, good. Thank God there's nothing wrong. I can get up and get out of here. Great. But there is a reality that we're not looking at. And even though our bodies are saying something different, our bodies are saying, no, I actually am tired. No, I don't feel great. It's nice to hear that my labs are normal, but there's a push factor that we're not doing. And that's what I want to bring awareness to, because labs are so critical and so important. And they do give your body a great readout of what's to come.
Yes.
And one of the things that we do not do is push to find out what is coming for us in our health, in our aging process. Those things matter. So just hearing everything is okay it shouldn't be the end all be all. Let's just say that. One of the things that I even learned is that I'll get the papers, I'll get the reports, but I don't know what I'm looking at. And no one is going to sit down and say, this means this. This means you need to get a vitamin for this or a supplement for this. This means in 3 years, you could be looking at, diabetes. None of those things show up on the labs, and no one is going to tell you that. Yep. So that's why this episode is super important, because we need a beacon, a map for what our body is getting ready to do or what it's not showing as of yet, but what we should be paying attention. So that way we're more preventative and we're more proactive than reactive. So that's why you being here is so important. So I want to start with talking a little bit about our labs. Like, give us a standard, like, what should we be looking for? What are the important labs? And what are the numbers and ranges that we should be monitoring as Black women? Because I think that we always do the standard blood sugar, thyroid, the typical things, but there are some tests that we're not requesting
No.
and we're not looking for that can tell us so much more. And it'll really kind of pivot the way our health is going. So just explain a little bit about that. And I'm excited to hear what you have to say because I'm going to be applying this.
Thank you. So the two that you just mentioned are extremely important, blood sugar and thyroid. But what I do want us to know is that we can go a little bit deeper in that. And that's what I think we should really be paying attention to. For example, there's a lab that's called, it's associated with our blood sugar. As you know, a meal that we have, if we just had an apple, if we had a donut, if we had a bowl of rice, that affects our blood sugar right after we eat it, right? Or, you check your blood sugar, test it on your finger, and it lets you know, oh, you just had a high sugary meal, and we expect your blood sugar to be high as your body like metabolizes the sugar. But when it comes to blood glucose, an important lab is called the A1C. It's apple, the number one, and C, think carbohydrate. Lets you know how your body is utilizing blood sugar and how your body is maintaining energy, right? So just a simple thing. We think, oh, I go to the doctor. I know about traditional blood glucose. My blood sugar was fine when I went to the doctor. Yes, your blood sugar might have been fine that day, but have you asked your doctor to do a level on you called the A1C? Because the A1C lets you know how your blood sugar and your body is metabolizing sugar over the last 3 months. Good. The other lab that I think that was really important, we talked about thyroid, like, oh, my thyroid's fine. My thyroid's fine. What I would say about the thyroid is that making sure that you're asking for a complete thyroid panel, not just looking at one aspect of the level, but looking at you have four components. You have your T3, your T4, your THC. So looking at those levels and making sure that it's combined all together when you're looking at your lab, because one thing your T3 might be fine, but your T4 is not. Your TSH is not appropriate. So this is why it's so beneficial to make sure that we're getting a complete panel of when it comes to our thyroid. Because again, our thyroid is like our little check engine light on the body. It kind of regulates everything else that's going on. I'll give you an example of why the thyroid is so important. A friend of mine, she was having spikes in her blood pressure. She thought it was related to the stress of being an entrepreneur. Her blood pressure was spiking up to 200 over 100. She couldn't understand, like, why was my blood pressure so high? But I don't think I suffer from high blood pressure. But again, as Black women, we go to the doctor and they're just heart disease. You have hypertension. Your mama got hypertension. Your grandmama had hypertension. And now you're 35 and it's your time to have hypertension.
Right.
Because there was a family history. So she said, all right, well, man, I must just have high blood pressure now. She started taking the medication as prescribed and started to notice that she'll get up in the morning after a few days and she started falling down because her blood pressure was too low. The blood pressure, the medication just was it was too strong for her. So that's what she thought. She's like, oh, maybe I need a lower dose. Maybe I need a lower dose of the medication. And so when she returned back to her doctor, and again, remember, she's an entrepreneur, so she's not able to just go to the doctor every day. This was almost 2 months down the road of having days of dizzy spells, falling down because sometimes the blood pressure is too low, because she honestly believed at that day that when she went to the emergency room that she was diagnosed with hypertension. She eventually realized that it was her thyroid. She had an overactive thyroid. She was suffering from hyperthyroidism when we did a complete panel check. So when she ended up going to the endocrinologist ended up making sure that she was addressing that her blood pressure and the spikes in the blood pressure that she was receiving was not related to cardiovascular disease, more related to an irregular thyroid. Her thyroid wasn't being underactive, it was being overactive.
Understood. Yeah.
So this is why it's so important. It's like, sure, she went to the doctor, took her blood pressure. It was sky high. She went to the emergency room and the doctor said, sorry, got hypertension. Let's throw you on some medication, because at the time that posed as the problem. But had she had the opportunity to really know her complete, which is why this conversation, I'm just so grateful that we're having this conversation, why it's so important to have a panel and understand your thyroid, your levels over, over the last 3 months. Maybe when she got to the emergency room, she says, "Can you look at my labs from the last 3 months?" Maybe something else could have, if the doctor had an opportunity to look at it, could have said, "You know what? Maybe it might be related to this. I won't put you on medication right now. Let's follow up with your primary in a few days." But this is where the benefits of knowing your labs and having at least lab work done twice a year, if you're not following up with your doctor every year, just making sure that you get your lab work done in a complete panel, which we'll talk about, throughout the conversation, at least twice a year so you have a baseline, just like we have a baseline for our weight, having a baseline for our labs, that when we do go to the doctor, if we show up when something is wrong, they have something to kind of reflect off of. Mm-hmm.
That's good. That's good, because that leads into exactly what I was going to ask: the reference range versus the optimal range. I think if we were able to kind of know more about that, about what is optimal and what's just a reference and where you fall in that range, in that spectrum, because that's a really strong reading. I remember one day I went and I got a check done, and the doctor just came in and said, "Your kidneys are a little dehydrated, so just drink some water." But then but it didn't sit with me well, because I said to myself, why is my kidneys dehydrated? What test or what was ran that said that my kidneys were dehydrated? Like, these are the questions that we don't tend to push back. We just hear a doctor, see a doctor, and we just run sometimes with it. And I
Mm-hmm.
think that understanding range is important, because you can start to really hear that, and then say, oh, wait a minute, that doesn't sound good. Wait a minute. Okay, maybe I need to switch something. To be informed and have knowledge of those things really allows you to dictate how your body moves, how it operates, and is it in its optimal. So if you can just explain that, that would be really good to understand what those two references mean.
That's a great question. So when someone says a reference range, or that it's within the normal limits, understand that it's about an average group of people that took the lab, and they're averaging your age, your sex, and your race in that factor. And this is within the normal range, right? So when we look at when we say something is in normal range or in reference, think about the real question that you're asking is, am I sick? That's what you're asking yourself. So when the doctor says your labs look fine, your labs are within the reference, the doctor's telling you your lab work is telling me that you are not sick. Now, the question is, are you optimal? That is saying, are you thriving? And those are two different answers, right? Like, is your check engine light is not on, but if you keep driving that car at E,
Correct.
the fuel
Correct.
injector is going to get damaged, and now you have a $1,300 job to get fixed with the fuel injector, but that check engine light isn't on yet. So that's really to compare the difference. So when someone says that my labs look normal, the doctor says that they're normal, they're within the reference range, the follow-up question would be, well, is it optimal? And that is where you're saying that, for example, if your fasting blood sugar is 99%, but we know that by at 100, we consider you pre-diabetic there. So maybe we should try to get that more optimal and see if we can get our fasting blood sugar down to 75. That would be a more optimal range based on someone's age and diagnosis. So this is, and a lot of times now, this is where medicine is going, making sure that certain labs are, you want that more in an optimal range, because that lets you know where you're projected to be in the next 5 to 10 years. For example, another important lab is called the C reactive protein, CRP. And that lets us know about inflammation in our body.
Mm.
And why that is so beneficial is that marker, the C reactive protein, lets us know as women our projection of estimation of potentially having a stroke or a heart attack. I know I need to have that lab done, because heart disease runs in my family, and my grandmother suffered a stroke at the age of 70, right? And so those are things that I particularly, the C-reactive protein, if anyone in your family especially suffers from heart disease, making sure that you know that level now at a young age, because, even if my blood pressure is normal, thank God, my cholesterol is normal, but I still would like to know that C-reactive protein to project where I can be in 10 years and what I can do in my life to decrease inflammation on living in such a stressful time.
Absolutely.
That's another, we talked about blood sugar, thyroid, the C-reactive protein to help us monitoring our inflammation in our body. Because today, your blood pressure is fine. My blood pressure is fine. Your blood pressure is fine. But it helps us see what our projections, where we can be in 5 to 10 years is beneficial.
I love that. That's so, the more that you talk, the more that I just say prevention is power, because inflammation is really the number one root cause of most of the diseases. And if we are able to read our biomarkers and understand that certain tests will tell us what inflammation levels are in our body, that's powerful. And I think that allows
It's
us
so
to
powerful.
change,
Yeah.
it changes the course of your life if you can master that.
Yeah.
So that's why I absolutely love that. And I'm going to be very honest. I'm going to tell on myself. I didn't know that about that specific test,
Yeah.
and
It's a
so
great test
that's
to have.
something that I'm kicking in the door. I'm like, give me this test, because that's really, really important. If you know anything, even about cultural wisdom, just understanding like inflammation when the body's not right, and just taking something that just soothes inflammation, calms inflammation. That's where we normally go when we hear, oh, your inflammation is high. But even just knowing what test to take to even determine that is so important. Are there any other biomarkers that Black women should be paying attention to? I know that we mentioned inflammation, blood sugar. We talked about thyroid, hormones, big, big, big one. Hormones, super huge. I know that
Hormones.
a lot of women are walking around with irregular periods and thinking it's normal.
Wow.
But they're not getting the tests that they need or understanding the labs of what
Exactly.
being anemic is. These are really big
So to
things
pay,
to
to
pay
talk
attention
about
to.
anemia, which is something that is suffering Black women, we are one of the number one we sufferers from anemia.
Yes.
There's a lab called ferritin, right? We know that anemia means low blood, your blood is low, things of that nature. But like for instance, when my mom looked at me and said, "I don't know, you're looking a little pale there, girl. Have you had your blood sugar checked?" What I needed to have checked were my ferritin levels. So as I'm sure, maybe, I don't know if anyone's heard this term. It's called, you have anemia or do you have iron deficiency anemia? And what iron does is that iron basically is like a great transporter of oxygen to our tissues and to our muscles. And understanding and not only knowing your hemoglobin levels, but knowing your iron storage is very beneficial in knowing how your body is transporting, how your red blood cells are transporting oxygen all over your body. And that's what I needed to definitely get checked, because some people have a lower hemoglobin, and a hemoglobin lets you know if it's really low, potentially you could be bleeding out, unfortunately, right? So if I was to, we've had patients that have suffered with fibroids, and when they're having their menstrual cycle, they unfortunately are bleeding extremely heavily. And I remember once having a patient in the emergency room, and her hemoglobin was 3. She actually needed a blood transfusion because of her cycle and because of the high bleeding. But what we also needed to give her, why with the blood transfusion, is making sure that she was having adequate amount of iron replacement, not just blood replacement and hemoglobin replacement, but that iron replacement, because it's basically just giving you a whole bunch of meat with no seasoning. Like it's not getting to what it's not getting doing the job that it needs to do, right? So yes, we know our hemoglobin and anemia is something that we definitely suffer with a lot as a community of Black women, but making sure that when our doctor tells us if we're anemic or not, asking what's our iron level? It's called your ferritin, which is your iron storage. So not just your blood level, but also knowing your storage of iron in your body, because
Amazing.
that goes hand in hand with the anemia, and
Amazing.
making sure
Amazing.
that oxygen is optimal in the body, and that the ferritin storage is important for that.
I want to touch on something really quick because now that I have you, I'm going to get you. So, so I know that there are specific different types of iron, right? So, when you hear something like, okay, you're anemic, we normally just grab an iron supplement, but it possibly can't, sometimes it's not the right iron that we need. I'm learning about this myself because when I was pregnant with both my children, they required me to get on an iron supplement because they were like, you were heavily anemic. And I was just like, okay, so every day during my pregnancy, I had to take iron.
Yes.
But it was prescribed to me. But I started to learn that there are different types of iron that our body responds to based on the type. Like you just mentioned, there's a different type of anemia. So, can you tell us a little bit about the difference in the iron for that? Because the reason why I want to talk about this because we hit the nail on the head with identifying that most Black women have heard, okay, you're a little anemic, or anemia is there. So let's talk a little bit about that to really target specific types of anemia.
Great question. So you have anytime you see a salt, you see ferric gluconate, ferrous sulfate. In the chemical world and in the chemistry world, it's just how the salt, how the medication is going to be metabolized in the body, right? So you have different types of iron. For instance, if you're someone that is suffering from iron deficiency anemia, we may recommend ferrous sulfate for you because of the way that salt is going to be absorbed in the body, and it has higher levels of iron. So even though the dose says, it's kind of, I hope I'm not getting too nerdy here with the science, but it's about
No.
the elemental iron that's in the product. So even though it's telling you that your iron supplement is 325 milligrams, because it's ferrous sulfate, there's actually only 65 milligrams of elemental iron.
Mm.
And depending on your anemia and depending on your levels, you would need a different salt form. And if anyone I was just speaking to a girlfriend of mine yesterday, because her iron levels are so low, her doctor completely bypassed oral tablets, and she just gets something called, she just gets iron infusions. And she gets that once a week, where it's the complete iron source, and it's just going directly into her bloodstream, because they're not even wasting the time of having her metabolize orally the iron. They want it to just go directly into her bloodstream because of how extreme her iron deficiency is with her anemia.
Understood.
But two things that I would like to say, just a little over-the-counter pharmacy trick. Believe it or not, vitamin C helps the absorption of iron. What I tell, my patients is that when you're starting to take an iron supplement, take it with a glass of orange juice or a glass of whatever you have that's high vitamin C, taking it with a vitamin C supplement, because it does increase the absorption of it in the body if you're not necessarily needing a more stronger form of iron supplementation due to your anemia. So there are little things that we can do to make sure that even though we're taking our iron supplements, that it's being absorbed. Do not take it with dairy or milk. Sometimes we like to take our vitamins with our coffee in the morning. If we like a little coffee in our cream, making sure that we're separating our iron supplementation from dairy, but making sure that we are taking it with vitamin C because it complements it and helps the absorption in the body.
I like that. Very good.
A second thing is why women often, especially as you know, with pregnancy, as we know, constipation is terrible. And having to take iron supplementation, the number one side effect is constipation. And so making sure as well, when we're starting to take that therapy, especially the oral, the IV form of iron does not cause constipation. It's the oral form. Putting on a little stool softener will be helpful to help us go, especially if women are having to take it while they're pregnant. we're already prone to constipation. And then if we're adding iron on top of that, whoa, baby, I know we're not feeling. I don't like that feeling. I know nobody else likes that feeling. Not everybody wants to talk about constipation, but it is a major side effect of iron supplementation, unfortunately. So I always tell, make sure we're taking a little Colace stool softener to help us go.
I want to ask you, what are the labs that we should be asking for annually? No ifs, ands, or buts about it. If we don't ask for any other labs when we go, what should we be asking for annually that will at least have us start to understand our longevity within our bodies? That's a really, I don't want to talk about the disease prevention part, because the thing is, when you go to the doctor and they read your labs, they already determined you don't have a disease. But I want to talk about the longevity part of it. What lab should we be requesting that talks to our longevity? I know you mentioned inflammation, which is definitely one of the top.
C-reactive protein, that is number one. Our C-reactive protein, because do you want to talk about biohacking? That is what, if you are able to reduce inflammation in your body and getting those levels at an optimal range, your C-reactive protein is one of your most important labs for longevity. I believe that our second one that is just as important would be our A1C. That gives you a 3-month report of how you are metabolizing your nutrients, and most importantly, how your body is utilizing the energy in the body. Looking at your A1C is extremely important. I believe in an annual thyroid panel, complete thyroid panel. That is something that is very beneficial. The last one, I think top 5. So our fourth level that I would love to look at is if someone is living with anemia, knowing what their iron storage is, but even knowing yours on a regular basis. What's your ferritin levels? Because when you go to the doctor or you go to the hospital, they're going to take your blood work, your CBC, you have a high hemoglobin, your white blood cell count. If you have an infection, yes, I know that every standard resident knows to order that. But knowing what your ferritin levels are is something that's extremely important. So we talked about the C-reactive protein. We talked about the A1C. We talked about our complete thyroid panel, ferritin levels. And last but not least, it's called a CMP, and it's a complete metabolic panel that looks at all of your electrolytes that are in your body. You should know if you're running low sodium, if you're running high potassium, low potassium, your CMP, knowing how your liver is working. So having that done annually is something that is always great to have in your back pocket, that if you are unfortunately sick and have to be presented to a doctor's office, again, it's a reference range. It helps the doctor, believe it or not, take better care of you, because at least you can say, this is what I look like today, but doc, this is what I looked like 4 months ago. So maybe that can even help with a better diagnosis for that period of time. But I think annually, those 5 labs are extremely beneficial in knowing for longevity. I know that I'm going to go get that done next week at my local LabQuest or LabCore, because I know the benefits of that. Because again, your doctor's going to say, well, we'll see you in 3 months and we'll see what we're going to do. But no, hey, doc, we don't even have to wait for the 3 months to see what we're going to do. You can see what I looked like 3 months ago.
Right.
Because I already have that. So we can actually come up with a better treatment plan today instead of thinking that it's just a one-off day. For example, my cousin with the thyroid issue, if she had that, the doc would have been like, maybe it's not, hold on, but we don't need to just throw you on high blood pressure medication. Let's manage the thyroid and see if that can help with the blood pressure.
Okay. So one of the things that I also want to tap into is, and this is a real critical question, and I think when we sit in the doctor's office, we don't even know that this is happening. But what are our doctors ignoring? When you go to the doctor, right, and they glance over your labs, what could they be possibly ignoring that's exclusive to Black women that they may not pay attention to? Is there anything on our labs that they're not paying attention to that are actually critical to Black women, but they may glaze over it because it just looks normal? What would that be?
A great question. And I think that our primary care, we have to understand that every doctor, depending on if you're going to a specialist or if you're going to a general practitioner. I love our general practitioners. They are the jack of all trades. They know a little bit about everything, right? However, your primary care physician is different to your gynecologist. Your gynecologist is specifically honing in on that lab work. Your cardiologist is going to order those more specific labs for the heart. Your endocrinologist is going to order those more specific labs for your hormones. So when I answer that question, I want to speak about it more on a general practitioner, primary care. You're going just for that annual. And I think one of the most important labs to look at is the C-reactive protein, because it's not always, and the reason why is because your inflammation really can tell you how the body is going to be responding. You can be completely healthy, a track star, runner, but knowing what that level is in the body is such an important factor, and it can direct you into knowing whether or not you need specialist care or not. I do not think on a regular basis, I don't even think they're ordering the lab. They're not ordering the lab. Now, our primary care doctors are a little bit more, especially as women are getting older, understanding the function of the thyroid in that respect and ordering the lab work. But the one lab that I do think is often missing is that C-reactive protein. And it is such an amazing lab to let us know about our projection for longevity.
This is so good because honestly, it seems like whatever question we ask about it, it leads back to this one test.
Stress,
I'm hearing it as number one. I'm hearing it as this is the test to ask for. And I'm
yes.
so glad because I didn't know anything about this and I now know what I'm going to be paying attention to. Can you tell us a little bit about interpreting that specific test? I think we're talking about it. We're saying this is what tells us about it. But what should we be looking for that's normal? What's abnormal? And what do we need to do to even get it on the right track? I think that's a really strong thing that we should be touching on. If
Yeah.
this is the end all be all for us, like if nothing else fails, we get this test. What's normal? What's not normal? And what can we do to fix that or even prepare ourselves to do that?
So that's such a great question, because I think no matter what the disease state or that someone is presenting with, the number one lifestyle management is about reducing stress. We hear it every day. If you're, just anxiety, find ways to reduce stress. You're dealing with hypertension, find a way to reduce stress. Everyone's telling you how to reduce stress, because we know with stress and cortisol comes the inflammation, right?
Mhm.
So when you talk, which is why this is such a baseline lab, because so many of us, we sometimes get so accustomed to our lifestyle that we don't even think we're under stress.
Right.
I compare it to, I was telling a girlfriend of mine, I said, we've lived life wearing, traffic shoes and going to the club. As long as they were cute, we just knew how to stand. And now we see the bunions and now we see everything else that's affecting. But at the time, we didn't think that we were damaging our feet. We were just saying that it's not, this was just how we had to dress and just be uncomfortable. So unfortunately, many times we get uncomfortable with our lifestyle and the body starts to use that stress level as the new norm. And the body gets accustomed to that. And our body is so amazing. Our body will adjust to any stressful situation. Our body will adjust like, okay, is that our new normal? All right, so I'm going to use this as normal. But on the inside, the body is still, to get to that new normal, so many different labs are such as C-reactive protein, it's overworking and creeping up and getting higher and higher, right? So to give you and my goal for every patient is to not so much, again, I like to focus on reduction of numbers and not necessarily having our patients really focus like my C-reactive protein is not 50. That means I'm going to, have this in 4 to 5 years. Not necessarily, right? But if you do notice that when you get your lab work done, that it's at an elevated level, just finding ways of slowly reducing it, just reducing it by 5 points, reducing it by 2 points. That is, you're going to see the quality, because now you're paying attention to so much more of a quality of your life. For instance, you want to know one of the number one ways to reduce C-reactive protein? Get some sleep.
Okay. Yeah, I'm telling you, we did a whole podcast episode on sleep. It is literally the number one protocol for your
And
life.
making sure
Sleep.
that your body
Mhm.
is getting enough REM sleep and going through those circadian rhythms, right? And so those are some of the things. We talk about reduction of stress, but I know I'm victim of I don't have time to reduce stress. I don't have time. I have this to do. I have that to handle. I have this to take care of. Stress is just my life right now. And what we do notice, and I'm sure we can attest to this, is that after very stressful periods, sometimes when the body gets a time to relax, that's when everything just starts to fall apart because you're finally in a relaxed space because of the elevation of the cortisol and the elevation in the C-reactive protein. So that is such a great lab. I think that for the start of the year, that is one lab that I think that we should always be speaking to our practitioners about and not hesitating to have them order that for us.
Absolutely. This has been so enlightening. I just
Yeah, thank
absolutely
you.
love that we have something that we can work with. I mean, even if you do take those, it is good to know how to read it, not obsessing on numbers, but how to
No,
reduce it little by little because all of it helps reducing that stress. And I can
yeah,
tell you right now, I think I've been sitting here and doing this now, and I'm telling you, stress is just literally the number. I can't emphasize enough how much stress management and stress reduction is so powerful for us because we don't often sit and think about it. We are in caregiver mode, we are in mommy mode, we are in life mode, and we don't stop to think about these things
we
until we
don't.
get sick. And
Until
I
we get
hate
sick.
that because
Yeah.
sickness is what slows us down. And
Nope.
too many people need us, as far as our children, our spouses, our loved ones. They need us. And when we're
Yeah.
not paying attention to ourselves, this is the end result. We're getting these high levels of inflammation. You know, we're listening to labs and we're thinking, all right, we're great. Our bodies do not feel good because our cortisol levels are through the roof, but no one checked on that. And I think that this was so good because it really tells us, like, hey, once we can at least master this, you'll get better at most things. You'll be able to
You
be like,
will.
okay,
It will, yeah, you'll start to pay attention. And your
absolutely.
doctor is going to start treating you like, oh, you're asking about C-reactive protein? Okay, okay. I know that I not your A1C, you're asking about the A1C, your A1C, not just what your blood sugar is today. So asking for these certain labs that show you a trend over 3 months, over a 4 month period is already allowing your provider to see that you are not just a patient that wants to know how I'm doing today. You're letting your practitioner know that I want to see what my health trajectory is going to look like for the next 6 months, in 6 years, in 16 years, right? And this is
Absolutely.
where we're starting with this lab work. And asking these questions helps give a great projection. And sometimes you're going to have providers that they have a huge office and they have a busy line of people out there for the day. They want to get you in and out. Insurance is only paying for 15 minutes for a visit. Let's
Absolutely.
be honest.
Yep.
So
Hmm.
they're only gonna give you 15 minutes of time, which is a brutal reality. So making sure that we are proactive and knowing the lab work and making sure that we're the CEOs of our body, because our insurance, my insurance allows me one free annual a year. That doctor is probably getting $25 for that visit. You know what I'm getting? $25 worth of questions. So I have to make sure that I have the appropriate questions to let that doctor know that my longevity matters not only to me but mostly to me, so I can take care of my family.
Absolutely. I think I really want to touch on what you said right there, which was super important. And I think that that is what the whole purpose of this is, to go in educated and empowered about what you're asking for, because they cannot take you for a fool if you do know what you're asking for and what you want to know. You look like a different patient. You know, my sister is a nurse. So when she goes in and she asks those questions, they're like, oh, okay. She
Yep.
knows what she's talking about. So they can't BS her on anything because
I
she
know.
knows exactly what to request. But that's not everyone. Everyone is
No.
not a nurse. So it's
No.
really good to understand that when you walk in there with, I'm asking for this, I'm asking for this, they're much less likely to treat you as get in, get out. And I think that's what I want for all of our listeners. I want that for all of the people watching and viewing this, that we want you to walk in empowered for what you're asking for. And you ask and ye shall receive. So we want you to get what you need.
And if your doctor or provider says to you, I don't think that lab is necessary, here's a powerful line, a very, very powerful line. Hey, I understand. Can you just document in my chart that I asked for that this visit and that you didn't think it was necessary? I guarantee you'll get a script for the lab.
Absolutely. That worked for me before.
Real
I'm
passive.
telling
You
you.
have real passive. Hey, you're the doc, you're the provider, you know more than me. I agree if you don't think I need it. But can you just document that I asked for it and just have it in my chart and that you didn't think it was necessary?
Yes.
Script.
Yes.
No.
Yep. They take it very seriously when you know what you're talking about.
Just
And
say
I
it
think
just
that was
like
so
that.
good. Thank you for that. That's and some women don't know. They don't know. So
Don't be
that is
intimidated.
so powerful. Thank you so much, Dr. Griffith. We're going to have you back. We're going to
Hey,
have you back
please,
because we have to
please.
talk about supplements. We've got to talk about, what we should be taking. I think you are
Yes.
so valuable to our community.
Thank
I
you.
think that just that little bit of intro into our labs and what we should be doing and taking is so powerful for us to really reclaim our health. So thank
Yeah.
you again
Yeah.
so
Thank
much.
you.
I
Thank you.
appreciate you.
And it's a reminder not only for the community, but also for myself. Like yes, I'm going to go make my appointment next week. New moms, we get so busy. And I'm like, no, absolutely. We have to have all these things documented. So thank you for allowing me even the opportunity to talk to myself as we've had our conversation together. So I look forward to more opportunities. Thank you.
Thank you.